Hi, my name is Alyssa Anglin, and today I will be discussing the International Dysphagia Diet Standardization Initiative, the IDDSI. This here is an image of the IDDSI framework. So what you have on your right is an upside down pyramid that represents the different textures of foods. If you start at the bottom, you go 3 liquidized, 4 pureed, 5 minced and moist, 6 soft and bite-sized, and 7 easy to chew or regular. Then, as you move over to your right, you have a pyramid for drinks and liquids, and this has to do with the consistency or thickness of the liquids as you can thicken them. So it starts off with thin, which would be like water, which is a 0. You go up 1, slightly thick, 2, mildly thick, 3, moderately thick, and 4, extremely thick. Now notice how 3 and 4, the colors of green and yellow, go across both the drink and food pyramids. You will be able to see similarities in moderately thick liquids and liquidized food. The same way you'll be able to see similarities in extremely thick liquids and pureed food. It's important to understand there are ways of seeing what the thickness of a drink is and what the texture of a food is. If you look on the top right, underneath that gray box, it says flow test instructions. I will give a small demonstration of the general concept of how to do a flow test, but I will also provide a link on how to properly do a flow test, as I did not have the correct instruments. I had a 5 milliliter syringe, not a 10 milliliter syringe. And when you look at these levels on the drinks and liquids, it has specific milliliters. So when there's a specific level of liquid remaining, it is directly related to the thickness. So let's say there's 3 milliliters left. Once you do the flow test, then you would have a level 1 slightly thick. But since my syringe is not 10 milliliters, I could not accurately determine this even just by sight. It doesn't work that way. It is a very accurate and precise measurement that goes into telling how thick each of these liquids is. When looking at these, it's important to distinguish between which one means food and which one means drink or liquid. So the way I remember it is if a triangle is pointing down, it's a food, and if it's pointing up, it is a drink. So how do I remember that exactly? Well, I think drink up, so you remember up, and foods you bite down, so drink up, bite down, foods and drinks. Now, here's an example. We know that it's a level 4 consistency, but is it a food or a drink? Well, it's going down, so you bite down, so it must be food. This is level 4, pureed food. Let's try it with a different one. Okay, same consistency, level 4, food or drink. Well, it's going up, so you drink up. That's right, it's an extremely thick liquid or drink. Now, I'm going to make some modified thickened drink. I'm going to use water. I was pouring that. And we're going to have our choice of using gel thickener or classic powdered thickener. Here's the gel packets, and here's the powder thickener. And I know it doesn't necessarily look like thickener, but trust me, it's thickener. So here is a mildly thick, a level 2 thickener. Here is a moderately thick, level 3. And here is an older one that says nectar consistency. Which one do you use? It's honestly preference, but gel tends to have less of a flavor, but because I haven't really kept these in a good temperature, I'm going to go ahead and use the powdered thickener, which I know is safer and better right now. So I'm going to mix 2 spoonfuls into this cup of water. I'm going to stir very slowly. Time for some shots. Just kidding. It's a measuring cup. It's a tiny little measuring cup. Now I'm going to pour the mixture that is already thickened into this little cup, just for ease of transferring the liquid. I'm going to take this syringe, And this is a 5 milliliter syringe, which is not accurate, and I know that, but just to show you the general concept, I'm going to suction the liquid out of this little cup. I'm going to remove the plunger, hold my thumb at the bottom, and pretend I'm counting down from 10 seconds, release my thumb, and then I would continue to see how much liquid is let out. Then, looking at how much is left, I would determine the level of thickness of this solution. Here, I'm going to show you this soy sauce, and you can see as I tilt it down, there's residue on the inside of the bottle. So while it looks to be somewhat thick or thin, well, we'll have to see about that. I'm going to pour it out here. It's very liquidy, it's very viscous, and I can tell you right away, just when I put my fingers in it, I can tell you right away as I stir it around, it's moving very quickly, very similar to water. There's no resistance, so this would be considered a thin liquid. Moving on to syrup. Typically, syrup is a thicker consistency, but the one that I used here actually turned out to be of a thinner consistency. I wouldn't know, I did not test it, but it is not, I wouldn't say it's thin. It might be mildly thick. I'd have to do a flow test. We have ketchup, and I'm very excited because I know this is already a thicker consistency than the soy sauce and the syrup. So I'm going to put it in here, and I'm not going to do a flow test. I'm actually going to use a fork to test the consistency of this. But watch how it doesn't move. It moves a little. There's a bit of oil in there. For the majority, it stays as one cohesive little gloop. So I'm going to take my fork here, and then I'm going to pretend I'm scooping it up, and look at this little drippage. It goes between the prongs of the fork and drips down, and yet it still falls off when I turn it over, and there's a little bit of food left on there. So I already went ahead and drained this can. It's little Vienna sausages, and I know that they are soft, bite-sized, they're tender and moist throughout. There's no liquid leaking out or dripping from it, which already makes me think it's a level 6, soft and bite-sized. You can push down on this with a fork, and it should squish completely, but not be able to regain its shape. I'm going to give you a nice picture here. When I look on the plate, when you push down, you can see the food come through the prongs, and watch, my finger nail gets blanched, which means you can see the white push down. When I push down, my nail goes white because the blood flow gets cut off. And that's how you know you're applying the right amount of pressure. So here you see the fork, the mark made by the fork, and you see the food come through the prongs, soft and nice. Here we have popcorn, and right away I'm thinking this is a level 7. Regular food, normal everyday food, various textures, age appropriate, biting and chewing. So here I'm pretending like this is what your mouth is doing. You're crunching it up, and look how much stuff is coming off, and look how much is left on my hands. That can easily be inhaled with somebody who cannot control their bolus and movements of their mouth. So easily break away pieces that can cause aspiration. We're going to talk about bread. Very important, comes up in a lot of meals. We eat tortillas and we eat bread at almost every meal. So here, it's important to make sure to break into appropriate piece. And I'm going to show you just how soft it is just by pressing my finger into it. You're going to see the blanched part of my nail again, and you see that it leaves a little indentation each time I press down. It's soft, but bread is dangerous. Why? If you've ever had a little sandwich, you realize that it gets stuck to the roof of your mouth, it gets sticky, and it changes texture right away. So it doesn't stay the same texture from the very beginning. It's soft, then it becomes kind of hard to move around. So you need to have good tongue control and movement in order to be able to swallow this safely. But if I were to take this bread and dip it in, let's say, water, I can soften it up and change the texture even more. So here, I'm taking a food that is somewhat dangerous and modifying it for a client so that they can still consume it, but at a much safer level that I know that they will be able to swallow, that it's not going to cause a risk of aspiration as it would if it were not moist. Here you can see how soft and squishy it is and malleable, and if I were to press down with it with a fork, you probably would have been able to see it retain some of its shape. Next, I'm going to show you a vegetable soup. You have noodles, you have vegetables, but you also have broth. This is a mixed textures, mixed of thin liquids and other solid foods. So why is this important? Let's think about a more common one you might have for breakfast. We have milk and cereal. Mixed textures. We have a thin liquid and a normal consistency of food. It's actually hard for someone with swallowing problems to move these around. When you're chewing cereal, you tend to swallow the milk first and then continue to chew the cereal. But people who do not have control over certain muscles and mechanisms in their mouth and oral cavity will not be able to move these two different consistencies around and are more likely to aspirate on the liquid. So it's very important that we know which categories these foods fall under, how we can modify them and make them safer for our patients.